we are waking this baby up now. He just had a dental procedure, and with a dental, we put them under anesthesia. We examine the whole mouth. The doctor will also examine after the dental cleaning to make sure that there are no dental disease, periodontal pockets, fractures, furcation, rotated or twisting teeth. And luckily for this patient, even with the amount of tartar that was on those back molars, we were able to clean them up and luckily did not need any type of extraction. You gotta look at the camera.
Now I'm gonna intubate the patient. Whenever we go into general anesthesia, the patient needs to be intubated to decrease the chances of aspiration. If they regurgitate or they vomit, you reduce the chances of that going inside the trachea, which goes to the lungs, and then you have aspiration pneumonia. By intubating, you maintain them under general anesthesia because we will have them with inhalation, ISO. The ISO will also maintain them under, and oxygen to help them be oxygenated at the same time. We lubricate the eyes because they don't close them when they're under general anesthesia. So the eyes can get really dried up really quickly, and then that can affect the cornea. They can then have ulcers or anything like that. So eyes have to always be lubricated under general anesthesia.
This baby is about to get a dental, so we are going to scale the teeth, get off all the plaque and tartar, make sure there's no periodontal pockets, attrition, or any type of fractures, and get him home safely. A lot of the signs for dental disease or what to look up for at home is just a buildup along the gum line, bad breath, lip licking, constant licking, and longer hair breeds. The hair will actually get stuck in their gums. And loose teeth, mostly the front incisors will be a little twisted or loose. On this patient, you see how red the gums are. So that is something important to look out for. Just becoming familiar with your pet's mouth. When you get new puppies, let them be comfortable with you touching inside of their mouth. Just pull their lips up once a week so they get familiar with it, and that will give you a lot of success in being able to monitor your pet's dental health. Eat these back teeth. This dog has a lot of generalized tartar buildup. I think he's an older guy, so it's a little more common for him to have more of the buildup, but he does probably have some beginning stages of periodontal disease. But hopefully with the medications that he goes home with today and this fresh cleaning, his teeth will heal up beautifully. So we're gonna, instead of trying to get this off with our handy little tool here, we're gonna need to get some big guys and chunk off some tartar to see what damage may be under here. So I always support it and I clank it off. And this looks like it was fractured and the body basically took over and was like, hey, we need to protect this tooth now. So that's why the tartar built up even more in that area, trying to protect the nerves from being exposed. So we are lasering the pet's mouth. So a lot of the scaling causes inflammation to the gums. To clean, so we are going to laser the mouth. The laser helps with inflammation, speeds up the healing process, and offers a lot of support to the skin tissue. So this should be a nice little benefit for this patient.